Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the shoulder complex. So it is an intricately designed combination of three joints linking the upper extremity to thorax, that is clavicle, scapula, and humerus. The articulate structure of shoulder complex are designed primarily for mobility, allowing us to move and position the hand through wide range of space. So the component of shoulder complex constitute half of the mass of entire upper limb. The components are connected to axial skeleton by single joint. So the shoulder complex include acromioclavicular joint, sternoclavicular joint, scapulothoracic joint, and glenohumeral joint is shown in the figure also. Acromioclavicular joint is a plain synovial joint and articulation is between lateral end of clavicle and small facet on acromion of scapula. The ligaments include acromioclavicular ligament, superior inferior acromioclavicular ligament, coracoclavicular ligament, having the lateral trapezoid ligament and medial conoid ligament. Movement available are internal external rotation, anterior posterior tipping, and upward and downward rotation of scapula. Resting position is arm rest by side. Close back position is 90-degree abduction, and capsular pattern is full elevation limited followed by pain at extreme range of motion. Next, sternoclavicular joint, which is a saddle shaped joint. Articulation is between two saddle shaped surface, one at sternal or middle end of clavicle and one at the notch formed by the maneuvering of sternum and first costal cartilage. So there is a disc known as fibrocartilaginous joint disc or meniscus. There is a strong fibrous scapula and the movement available are elevation, depression, protraction, retraction, anterior posterior rotation of clavicle. So the ligaments include sternoclavicular ligament with posterior and anterior ligament parts, costoclavicular ligament and interclavicular ligament. So the resting position is again arm resting by side in normal. Close back is full elevation and protraction, and capsular pattern is full elevation limited followed by pain and extreme range of motion. Scapulothoracic joint is formed by articulation of scapula with thorax, which is not a true anatomical joint because it has none of the usual joint characteristics. In fact, articulation of scapula with thorax depend on integrity of anatomical AC joint and SC joint, and any scapular movement on thorax result in movement in either AC or SC joint or both. That is, functional scapulothoracic joint is part of true closed chain with AC joint and SC joint in thorax. Next, we are having the glenohumeral joint, which is a multi-axial ball socket synovial joint. It composed of large head of humerus and small glenoid of fossa of scapula. It is surround and attached to periphery of glenoid fossa, enhancing depth or curvature of fossa by 50%. It is surrounded by large loose capsule. Ligaments: superior glenohumeral ligament, middle glenohumeral ligament, inferior glenohumeral ligament, and coracohumeral ligament. So the resting position is 40 to 55 degree abduction, 30 degree horizontal adduction. Close back position, full abduction and lateral rotation. Capsular pattern, lateral rotation, abduction and medial rotation. Degree of freedom, 3 rotational and 3 translational degree of freedom. Movement: flexion, extension, abduction, adduction, internal, external rotation and circumduction. So in this figure we can see all the different movements available at the shoulder joint. Thank you.